Kenya's journey toward accessible healthcare has seen major shifts, yet the dream of universal health coverage remains unfulfilled. While strides have been made in the fight against the disease, the harsh reality is that millions of families remain just one illness away from poverty. And now dwindling donor support threatens to reverse the fragile gains achieved over the years. Elizabeth Atieno reports.
In 1963, when Kenya gained independence, poverty, ignorance and disease were identified as the three great challenges facing the nation. 62 years later, those problems remain stubbornly alive. As of 2022, 15.9 million Kenyans lived below the absolute poverty line, a reality that continues to deny millions access to quality health care. Despite numerous interventions, including enshrining healthcare as a socio-economic right under Article 43 of the 2010 Constitution, quality and affordable healthcare remains out of reach of many Kenyans, with millions of families just a disease away from poverty.
We have another irrevocable decision that no Kenyan should be too poor to live.
The gaps in healthcare provision forced retired President Uhuru Kenyatta to launch the Universal Health Coverage Program in January 2019, aligned with a UN resolution of 2012. The defunct NHIF had 14 million registered members and 12.9 million dependents, covering nearly 22.8 million Kenyans.
For decades, universal health care was spoken of, but in our time, it is being actualized.
In October 2024, President William Ruto's Kenya Kwanza government unveiled the Social Health Authority (SHA) to seal NHIF's gaps. So far, 27.2 million Kenyans have registered.
19 million Kenyans who were once forgotten are now in the healthcare equation.
But the scheme has faced turbulence, among them service suspension by RUFA in February and September over a contested 30 billion Kenya shillings debt.
How are we going to compensate providers that have been treating Kenyans using the old NHIF capitation?
SHA has also been rocked by allegations of fund misappropriation and fraudulent claims. On September 1st, 2025, the Ministry of Health handed over 1,188 files of fraudulent facilities to the DCI.
The biggest issue we are facing, which has bedeviled the former NHIF, is fraud. Claims worth 10.6 billion have been rejected due to fraudulent activities and non-compliance.
Meanwhile, 1.4 million Kenyans living with HIV face a crisis after the US froze donor funding in January 2025. Access to ARVs has dwindled, infections are rising, and stakeholders warn of a reversal in hard-won gains. The burden of non-communicable diseases and persistently high maternal and child mortality rates compounds the crisis. This year alone, 20,000 newborns and 924 mothers have died during delivery.
Our maternal mortality ratios remain above the SDG 3 target of 70 per 100,000 live births. And the neonatal mortality stands at 21 per 1,000 live births.
Since 2013, healthcare has been devolved to counties. While some have reported progress, others remain crippled by persistent health workers' strikes.
Na tunakuja hapa kuhamasisha Wakenya, kuhamasisha clinical officer, kuambia kama hawatakuwa wameweka sahihi na serikali ile ya gatuzi kumaliza kataba yetu, tutaanza maandamano makubwa tarehe 23 ambapo tutaanza mgomo.
The Abuja Declaration requires nations to allocate at least 15% of their budget to healthcare. In the 2025-2026 financial year, Kenya allocated 138.1 billion Kenya shillings, a modest increase, but still far from the mark.
The exchequer doesn't have the money, and so you're finding at times the hospitals are ceasing to offer SHA services. There are several other issues.
The World Health Organization insists that delivering on the UHC program promise demands strong, efficient, and equitable health system rooted in communities, with primary healthcare as the most effective and cost-efficient path forward. Elizabeth Atieno, TV47, Nairobi.